Thank you so much, Katie Moran. Thank you to Mouse for Migraine for having me join all of you today. And I'm very excited to be here with all of you. And advocacy, education, and just raising our voices about migraine disease is something that I'm passionate about. And so I'm happy to be here. So I am going to share my screen and see. Let's see if I can share the PowerPoint. All right. So, okay.
Looks good.
Got it on there?
Yep.
Okay, perfect. So what I wanted to talk about today was navigating relationships with migraine. And that's something that comes up very often in my clinic and also on outside conversations that I've had with individuals. And not only migraine, just chronic pain in general. And this is something that I've even dealt with myself outside of medicine. So these are the objectives that I wanted to communicate today. So we're going to define types of relationships and their importance, demonstrate differences between healthy and toxic relationships, review the evidence behind the impact of migraine on various relationships, and highlight the role of the individual, yourselves, with migraine in maintaining healthy relationships, and understand how to utilize relationships to benefit persons with migraine disease. So this is the one part where I'm going to ask you to unmute if you'd like to say something. I want to hear what, in your opinion, is a relationship. Anybody, even if especially if you have a camera on, if you want to just say something like, what do you think encompasses a relationship?
Family, friends, obviously a partner if you've got, I think so.
Yes, very good. Anyone else?
I'd say connections with just anyone else.
A relationship that has communication both ways and mutual respect.
Wonderful. So we had connection, mutual respect, different types of relationship, family. Anyone else?
That's what I was going to say, a two-way street. You have a two-way street with them, back and forth.
Very good. All right, now you can mute. But those were wonderful, wonderful depictions of what relationships are. And that is absolutely true. So over here, you see that there are several types of relationships, and you already named them. Relationships within family, friendships, romantic relationships, acquaintanceships, work school relationships, which are employee, employer, student, teacher, colleague. And then there's the community, which what you all are to each other here, community. The most important relationship, I think, in my opinion, is the relationship with yourself. In order for you to have positive and fulfilling relationships with others, you need to turn to yourself and make sure that relationship is wonderful, positive, and fulfilling first. While there are different types of relationships, within relationships, there are facets, right? So I break them down into two just basic. There are healthy relationships and there are toxic relationships. And it's important to understand the difference and be able to recognize them in order for you to understand how they impact you and how to lean towards them or move away from them to keep your inner peace. So you see here, healthy relationships leave you feeling capable. They leave you empowered. You feel good. They're challenging, but that challenge is necessary. Conflict can be necessary because that leads to growth, right? So that's like a good movie. If you think about a movie that you really like, most critically acclaimed and good movies involve conflict, right? And through that conflict, the main characters take on those challenges, and at the end of it, they grow in different ways. So challenges are important within a healthy relationship. There's, and someone already said these, there's mutual respect between the parties that are involved. There's There should be open communication. There transparency of expectations. A lot of the times people can have conflict because of a mismatch of expectation and reality. So there needs to be transparency in that, and that both parties are aware within that connection. There needs to be a level of support, and that support is simply there to lift you up and help you be independent. It shouldn't be a support that leaves you completely 100% dependent on the person, right? It's like, you know, if you have children or if you're mentoring someone, you're supporting them to help them fly and be on their own, rather than supporting them to have them constantly need you a lot. So that healthy relationships need the support for independence. Toxic relationships are just simply the opposite. They leave you feeling dependent. You can't do anything on your own. You feel bad. You often feel defeated. And instead of progressing to higher grounds, you regress to lower grounds. So it's important to recognize that. Think about how you feel in the connection that you have with whatever relationship that you're in, and determine whether or not, is this something that's healthy for me, or is this something that's toxic? So I start here with self, because like I said, that's the most important part of a relationship. So you need to recognize how to create a healthy relationship with yourself. And how do you do that? The first thing I say is to know yourself, right? In order to know yourself, it helps you identify your likes and your dislikes. It helps you identify when, you know, something might change your threshold in your mood, and it helps you recognize key motivators. And how do you do that? Simply spending time with yourself and understanding how you tick. You know, it might involve you reading self-help books to help elucidate those different facets. So you need to know yourself before you can let others in. The next thing is recognizing negative self-talk. Now, what self-talk is basically a combination of the conscious and the unconscious, right? It's our interpretation of what's happening around us, and we formulate an inner dialogue based off of that. And the negative self-talk tends to rear its ugly head whenever there are times of distress, right? So we want to be able to recognize that and reframe it. You want to flip the switch on the negative to turn it into a positive talk, so that you can have a supportive foundation for yourself first before somebody else can support that foundation. Next one is practicing mindfulness and meditation. And I think that helps you do the know yourself and also recognize negative self-talk. We know that mindfulness and meditation has great evidence in therapy for migraine disease. And I think it's really important because it helps you kind of take a step back, and it can help mood shifts. And also it involves incorporating gratitude. When we are in times of stress and when we are in down times and engaging in negative self-talk, the best advice that I've ever gotten was, all right, when you're in those times, breathe, right? We want to concentrate on something that's completely out of reach of whatever is going on. Take a step back, breathe, count your breathing. And then within that breathing, you can think about principles of gratitude. What am I happy about? What am I grateful about in my life right now, despite what's going on? And that can be a powerful way to shift mood and to also help flip the switch on the negative self-talk. The next one in creating a healthy relationship with yourself is to feed your soul. You need to identify small little nuggets of happiness in your life, little things that help you happy. It could be the cup of coffee or the tea, like I have a latte here, and that made me happy this morning, and it makes me happy that it's just right there. It doesn't have to be that I'm going to a glamorous party. It doesn't have to be that, you know, I'm engaging in all different types of activities, being outside. It can just be one small little thing, the way I wear my hair, the shirt that I'm wearing, you know, the earrings that I'm wearing, anything, just little small nuggets of inner happiness. And that helps you put less emphasis on the big things that you may not be able to do when you're in times of distress, and it helps keep you grounded. Next thing is just stop repeatedly apologizing to others, right? And I mean this also with respect to your disease, right? We got to be careful, because if you do something wrong to someone that you weren't aware of and it's time for you to apologize, yes, you should reflect and apologize. But when it comes to your disease, something happens when you put yourself in the position to apologize. There's guilt that comes with it. And with migraine disease, it's not your fault. So apologies are not necessary. Now, there are times when apologies can be there to provide support, like I'll explain later in a parent-child situation, especially with young children. That may be important to help provide support. But in general, around you, I think that can further the stigma, and that can further the inner guilt that we feel when we're not able to do certain things. Now, stop apologizing to others, but I need you to apologize to yourself, right? Because if you're in a certain position and you're unable to do something, you shouldn't be sorry to yourself. You should be easy on yourself. I want you to celebrate small wins, practice compassion towards yourself. We very rarely practice compassion towards ourselves as much as we do for others. So make sure you hold yourself in high regard and take care of yourself. It's part of practicing that positive self-talk. It's part of celebrating small wins. You got to let your inner cheerleader shine, because no one's going to cheer you on harder than yourself. So remember that. And how do you create healthy relationships with others? Again, set realistic expectations. You never want to have a mismatch between your expectation and reality. And if you don't communicate those expectations to the others in your relationships, that can create an unhealthy type of conflict. So communication is important with that. Also practice listening. We all want others to listen to us, but we should also listen to others as well. People tell you who they are. They show you who they are in their actions and in their words. So you're listening with intent, and you're listening also and reading in between the lines of what they do and how they carry on. Share your experiences. We're not mind readers, right? No one is a mind reader. It's important to understand, in order to understand where you are coming from, you have to share your experience in order to also help the other person grow, so that they can better provide support in your life. And then the last thing is recognizing that toxicity. Many times we have certain relationships that are toxic, that we have to figure out why they're toxic and compartmentalize them, where we might end the relationship, or we might say, all right, when I'm in this certain situation, this person is good at this, but not good at this. I will not turn for them for whatever they're not good at. So you want to recognize toxicity and what about it that's contributing. So we're going to move on to the part where we talk about what we know about the impact of migraine on relationships, because we know quite a lot. So there is an epidemiology study called the Chronic Migraine and Epidemiology Outcome Study. And it's a large database that's about 13,000 participants. And there has been various data that has come out of this pool. And portions of that data has been published throughout the years under different categories. So over here, you see a recent study out of this data that was published in 2019 by Dr. Buse out of Montefiore. And you can see here, we're looking into factions of relationships, different types of relationships. And this portion of the study we see here, romantic, domestic relationships and partnerships. How does migraine fare in those? And you can see out of the respondents of those participants, 17% of those who were not in a relationship stated that headache impacted their ability to have one. And then you see 49%, and that's about half of the people in a relationship reported that they would be a better partner if they did not suffer from headache or they did not have headache. Out of those in a relationship and not living with their partner, 18% stated that headache contributed to the relationship problems. And of those in a relationship and living together, they made family planning decisions based off of headache. 3% chose not to have children, delayed, or had fewer children because of headache. So you can see here, we have the evidence here. Yes, we believe you in our clinical visits, but the evidence is here. You know, it's there. People are communicating this. This is out of the same year publication. They looked at the employer-employee relationships and the career impact. And 33% of individuals stated that headache negatively impacted one or more career areas. That's relationships with colleagues, ability to do their work on a daily basis, and ability to be promoted. And then 32% reported being worried about long-term financial security. We see from the same study that chronic migraine is 2 to 3 times more likely than episodic migraine to affect several aspects of career. And 23% worried about losing their job due to migraine, and 29% worried about covering household expenses. We see here, overall from the study, up to 13% of individuals stated that headache affected their partner's career in addition to their own. This same study looked at also life in general with migraine, and I kind of call this relationship with self. Over more than half stated their level of stress would be better without migraine. We had made comparisons with chronic migraine in comparison to episodic migraine, and those with chronic migraine were 1 to 2 times more likely than episodic to have a better life to say that they would have a better life without migraine. And you see here, both episodic and chronic migraine at different percentages reported that life would be better without migraine in terms of overall health, stress level, enjoyment of their free time, finances, romantic relationships, their child's life and getting along with them and their quality of life. So you see different aspects that are impacted here. This is the same data set, but published in 2016 under a family burden module. So they looked into familial relationships. So you can see here, again, we have the breakdown of episodic and chronic migraine, but you can see high percentages of individuals stating that, see here, 44% of individuals with chronic migraine, their spouse or partner didn't recognize the impact of their migraine. Someone that was with them didn't recognize it, living with them every day. 49 to 57% reported that they had reduced participation in family activities. And I see here 72% of those with chronic migraine believed they would be better parents if they didn't have migraine. See here, people with migraine reported higher family burden due to migraine. This is a 2018 publication of the data set, and this looked into adolescents aged 13 to 21 years old living with a parent with migraine. And from that data set, we recognized that the adolescents reported that because of their parent with migraine, they felt that they had loss of parent support and reverse caregiving, where they became the caregiver instead of the parent. They had a much harder emotional experience, difficulty with school, missed activities and events. And it did show that adolescents with chronic migraine parents with chronic migraine had more of a burden than those with episodic migraine. And you see here in the blue, I stated, moderate to severe anxiety symptoms were higher among adolescents with parents with chronic migraine than episodic migraine. The depression scale was similar. There wasn't a higher than that showing. And then this is the same data set published in 2019 looking at children, so ages 11 to 17 years old. And this was headed by Dr. Seng, who you will meet later. And it looked at how much these children's lives were impacted by their parents with migraine. And we see here that the greatest impact was on their global well-being, okay? We also saw that a higher migraine attack pain frequency and endorsement of severe disability correlated with the child's impact scores being high on global well-being and impact on personal future. And higher attack pain intensity correlated with the children reporting more of a burden of needing daily help and their emotional impact. And over half of the children reported that service or intervention would be helpful for assistance in managing the impact of their parents' migraine on their lives. So this is saying that they think they wanted more support, outside support, rather than just them being at home with their parent and within the family.
These work from the large data set. Those were our kids. Those were kids from Montefiore and from North Baltimore. So those are New York City kids who are telling us, you know, my mom and dad have migraine, and I just really feel like we could use more help, like getting through the day and getting to school and getting to all my activities. So I thought, you know, they were so eloquent and really sweet kids. And they are, you know, really worried about their mom and dad who have migraine and know that they need a little bit of help.
And that's important to recognize too, because you can see here in navigating relationships with your children, sometimes we may not recognize this. So this can allow us to be upfront with that. Talk to your healthcare providers, talk to social workers, anyone that can help provide that support so that things can be a little bit more smoothly in our lives for you and your child. All of this to say is that migraine is the second leading cause of disability worldwide. We know this. We see the impact on relationships and different facets of life. And I put this on here, it's just a headache, because a lot of the times it's usually the strain in relationships is due to a misunderstanding of the process and what you are going through. And this phrase is a representation of that. And what we're trying to do is debunk that phrase, eliminate it altogether, and help ease that and improve relationships with individuals living with migraine to help them thrive. All right, so how do we make relationships work while living with migraine disease? So I broke this down into different facets. So let's talk about home life. So with home life, first thing is just don't downplay symptoms. And what does downplay means? Downplay basically means that if you're experiencing something or like a pain or headache that's severe, and a family member asks you, oh, how are you doing? I know you have a migraine. Can I help you in any way? You say, oh, I'm fine. Don't worry about it. Go about your business. When you're really not fine, that's called downplaying your symptoms. And the message that you send there is what you're experiencing is not a big deal and you'll be okay. Yes, it's important to be positive, and yes, you will be okay. But if it's impactful, they should know that it's impactful, because then you may be perpetuating the phrase, it's just a headache. So next time it happens, they'll learn from that behavior and they'll think, oh, she just has a headache. I'm just gonna go about my business and not help if you need that help, okay? So don't downplay the symptoms. If you need help, ask for help. This is within your household and this is outside of the household, okay? Your community can also help with that. I'll pinpoint that later. Bring a family member to your appointments. A lot of my patients state that their partners or parents or individuals that they live with don't really believe them or understand what they're going through. A really good way to help them understand what you're going through is to bring them along with you. That's going to allow them to see the gravity of what's happening, allow them to engage and ask questions with the provider. And also the provider, like myself, gets a broader snapshot of what's going on. So when I see you in the clinic, I don't see what happens when you're at home. I don't see that you're spending your days laying down, what it looks like from the point of view of your spouse or your partner or a family member. When the family member comes, they're able to communicate that. And their communication is usually, this is how this impacts me. This is how I feel when I see this person in this state. That broadens the scope to the provider, and that really helps both parties within the visit. Next way is communicate what is and isn't helpful during attack periods. So I say that because you help your partner or family member be involved in what's going on, right? You want to share your migraine action plan that you've had with your doctor's visits, and you want to point out what parts in the plan that they can help with, right? So if part of your action plan is getting your device or getting ice, you don't have to go do that. Oh, I know whenever Sally has an attack, I'm gonna go get the ice. So, and they feel like, oh, this is my job, like this is important for me to do. And so they go get the ice. They're helping to take care of you, and you're allowing them to be a part of the process. And that's important. I know when Jeffrey has his attack, he needs to be in the back room with the door closed, and I go get the ice. So, all right, kids, let's go do something else. I'm gonna go do this. You know, everyone has their role, is what I'm trying to say. Everyone plays their part, and that's important. Work on lessening the guilt associated with recovery. You know, migraine is not only about the pain, right? The pain is there, but there's also a process that happens afterwards. You can feel foggy, you can feel kind of weighed down and drawn out, and you need that recovery period. And that's also a period of rest. And feeling guilty about not taking part in things during that time, that's not the time for that, okay? That's the time for mindfulness meditation and thinking about gratitude and thinking about small nuggets of happiness and working through those as well. Continue ongoing discussions about disease impact. You want to continue those discussions about how you've been doing. I have patients who talk to me about little activities that they can do as they progress. Oh, like 2 days ago, I was able to do 2 loads of laundry. Not that laundry is enjoyable, but this person likes doing laundry, and they said I was able to do 2 loads, and I used the Gain detergent, and it didn't bother me, and I was happy about that, and I folded those clothes like nobody's business, and she was happy about that, and that's a small win to me, okay? And that comes in different forms. So celebrate the small wins within yourself and with others in your household, and that's important within your home life. Romantic platonic relationships. Be honest about how you're feeling, okay? Concealing furthers the stigma, and that's the same category of don't downplay your symptoms, right? So this is just another form for the romantic platonic relationship. Continue to make plans, all right? That's important in order for you to still establish your connection with the other person. Make a list of high intensity plans that you can do when you're well, and make a list of low intensity plans that you can do when you're under the weather. So card playing, stretching with your partner, that can be a great romantic and intimate connected activity that you can do with someone when you're feeling like, when you're low intensity. And they can stay quiet during that time too, right? You don't need to have to talk to each other while you're stretching. Create a safe space if needed. Create space if needed. So that means you don't have to be with them 24/7. It's okay for you to take time by yourself. It doesn't have to have a negative connotation associated with it. It allows you to recharge and be successful at reframing that negative self-talk. And it also cultivates the independence of your inner positive self-talk, right? So it helps you create that independence that you need, and it helps you kind of just reframe by yourself. Express gratitude. So take time to acknowledge efforts of your loved ones, and also that acknowledgement and positive reinforcement strengthens that support. The parent-child relationship. Teach your child about migraine. There are so many, they're not so many, but there are children's books out there that depict families with migraine, individuals with migraine, and how they impact the child and the parent. Simplify your teaching and involve your child in your comfort measures. And I say that at your discretion. There are varying degrees of this. I have parents who bring their child to the appointments, and I do injections, and I try my best to not let the child see the injections, and I ask beforehand. And I have some parents, oh, she knows that I get needles, and I tell her, and she's expecting to see them. And so at that point, what I do is, okay, I wear gloves. Here's a pair of gloves. You can put them on, and you can be there, hold mommy's hand, and let's get this done. So that's kind of like bringing them into the picture, and that also helps with their development and their understanding and their development of compassion. You start young, right? And that allows the stigma to lessen, especially for that person. Acknowledge their feelings, provide emotional support, and lower your threshold for professional consultation. And that's what we were talking about based on the recent study from Dr. Seng. A lot of the children in that study really wanted the help. And so it's important to recognize when that's needed. Also lean on community. There are local parent and child circles that can provide support. And they can also be there for your child if you're not able to. For example, if there are activities that are going on the weekends, they can help with picking up your child and bringing them there if you're comfortable with that, and spending time with them, allowing for play dates to continue even if you're under the weather. And that fosters continued child development. And then within that, also advocacy groups such as this one can help with that as well. Work relationship. Always discuss work obligations with your healthcare provider. This allows you to lessen the anxiety around your migraine disease and the impact that it has on your job. And it also helps you stay ahead of the conversation that you need to have with your employer. So within that conversation, there needs to be discussion about the severity of your disease, the work description, what work triggers there are, and what work accommodations you need. You start that conversation with your headache specialist or provider, and then you can then have that in a nice, neat package for your employer. Collaborate with your employer. So a lot of the times I hear this antagonistic relationship that happens between the employee and the employer. I want to think about this as a collaboration. They want you to be productive because they're your employer, and you want to be productive because you are doing your job and you have a certain passion about it. The Americans with Disabilities Act does require employers with greater than 15 employees to accommodate reasonable needs of employees. So they do have a responsibility to provide accommodations, and that's going to allow you to be productive, and that's a win-win for everyone involved. The other thing that comes along with this in terms of the conversation that you have with your provider is that it prepares you for Family and Medical Leave Act documentation, and that's what we call FMLA paperwork. It's for the individuals with that ailment, migraine disease, and even the caretakers, and it provides up to 12 weeks of paid leave in a 12-month period. And so what it does, it's paperwork that's filled out by your provider, and it explains your medical condition, what's needed in terms of accommodations, treatment, and recovery. And you can write things like, this person needs low lights, this person needs 1 to 2 hours to get to the visit from work and come back, and needs recovery and needs time for treatment. And so that helps kind of streamline things. And then be transparent at your discretion. So I always talk about expectations and not downplaying. This can get a little complicated at work. I was a huge proponent with saying, yes, you need to say what's going on with you. You need to be upfront about it. But the reality of the matter is not everyone is receptive to this. And also, quite frankly, in order for you to keep your peace, it's not your job to keep explaining things to individuals who just may not matter in the equation. And that might be colleagues that you're not friends with. And so you have to decide what you reveal to your colleagues at your discretion and within the realm of your inner peace, because that's the most important part. So in summary, cultivating healthy relationship with yourself is essential for thriving with migraine disease, and a strong sense of self is going to help you develop positive relationships around you to use them for support. We know that migraine disease not only impacts persons with it, but also our relationships within the household, outside environment, and work life. And communication, honesty, sharing are key aspects for maintaining a support system within relationships. Thank you so much for allowing me to give this talk today. And then I'll take any questions if we have time. I know I ran over just a smidge.
Thank you so much. Sorry, I was muted. I was muted. That was wonderful. We don't really have any questions. We have one comment here that we talk about frequently in our support group. We feel on the positive side that that parents with migraine that have children, we honestly think that it also teaches them a lot of passion and compassion towards others, because they see their parent or parents with migraine, and so they learn so much compassion by being with their parents. So we think that they get a lot of positive energy from that as well. So we talk about that a lot, and that was shared by one of our support group leaders. So we wanted to share that with everybody.
Yes, I believe that 100%.
Yeah. I think it made us realize that, migraine is a lot. It takes a lot from our relationships, is what someone else is saying too. And I wanted to share one thing that we've also found. So there's really not just thank yous, and people can't wait for the slides to share with others. One thing we have found, I'm going to share real quick, is in our support groups, we have some people that have had trouble with their relationships, if it's with their parent or their spouse. They've brought them onto our support group calls. And so what they have done is they have seen two things. One, that others have migraine. So they might think, oh, you're the only one that has migraine. Why are you, blah, 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 if it's your spouse. Stop complaining and that type of thing. And then they get on the call and they see there's others that have migraine. Oh, wow, look at all these people on the call. There's 20 of you. And the second part is they hear all of us talking about our migraine, our symptoms, or whatever it might be. And it has strengthened their relationship tremendously. One was with a mother-daughter, that the daughter had to move back home with the mother, and one call it took, and their relationship was like this again. So there's some positive things with that too. So I just wanted to share that with all of you from listening to your slide, that that has helped relationships get stronger.
I think that's amazing. I like the support group realm of it, because I think also that relieves the burden of the person living with migraine to have to keep explaining this over and over again. It's like, let me just bring you to a forum so that everybody else can explain this to you, and you'll have 20 people explaining this to you, and then you'll finally get it, rather than me, myself, and I telling you this over and over and over again. So that really just, because it's exhausting to do that. So that just, it's like having an assistant, like somebody else is doing this for you, and it really does get the point across. So I think that that's really powerful.
Yeah, it's worked really well. So Thank you so much. You were wonderful. And again,
you.
all of these presentations will be on our YouTube page. It takes a few days to get them together for all of you, but they will be on our YouTube page, so you can just really listen and not worry about taking too many notes, although I did take a bunch of notes. Thank you very much. And let me bring up